Well, many aspects of COVID-19 remain a mystery to healthcare professionals. In this report, Cleopatra Murphy discusses the long-term implications of COVID-19.
Having been discovered in late 2019, National Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes, says there is much more to be learned about COVID-19, including the long-term impact that health officials are learning about daily.
There can be lung damage. In fact, there are patients who've had to get lung transplants, and that is an extreme complication, but notwithstanding that, patients can have significant inflammation in their lungs. We're finding out some of them may have cardiovascular complications that is affecting the heart, and just about 2 weeks ago, we heard that it could unmask diabetes.
Officials have also reported rare cases of pediatric inflammatory multisystem syndrome in children, an illness that can lead to long-term coronary damage. Forbes says to date, the Bahamas has not had any of the serious complications that some countries have seen. The possibility of persons previously diagnosed with COVID-19 being reinfected has also emerged, and Forbes says what is known about COVID-19 was based on other coronaviruses like SARS and MERS that provided some immunity.
The immunity can be anywhere from months to up to 2 years. And so it was thought that there should be some immunity from this new SARS coronavirus too. Although we don't know how long that will be, it can in fact be waning. And there are reports that the antibody response, that's what makes someone immune to an infection, could wane over a period of time. And so it is indeed possible that if the antibody response wanes, persons will be able to be reinfected. But we wait to hear more about that, and we will learn more about that as time goes on.
Forbes adds that recovery period can be protracted in some patients. A recent study by a German university also suggested that previous exposure to some coronaviruses like the common cold could provide a degree of immunity against COVID-19. Forbes says it is too early to tell conclusively.
Sometimes in some viruses, we wonder if there's something called cross-protection. So you've heard of that, for example, with the flu virus, influenza. There can be cross-protection between different strains, but we don't know enough about SARS coronavirus 2, which is causing this new outbreak, to know if that is the case.
Until the Bahamas gets COVID-19 under control, Forbes encourages everyone to do what they can to prevent the spread of the virus. Cleopatra Murphy, ZNS Network News.